Most seniors are told their blood pressure is too high, when it actually isn't, and others are told it's fine, when it's quietly damaging their heart and brain. The problem isn't your blood pressure, it's that most people have never been given a clear explanation of what those numbers actually mean. I'm Dr. Mandy Thomas. Today, I'm giving you the honest breakdown most appointments don't have time for, which numbers are genuinely dangerous, which ones are just signals, and how to know when it's time to act versus when it's time to breathe. And here's something that surprises most of my patients before we even get to the numbers. Most people are measuring their blood pressure completely wrong, which means the number they're worried about may not even be accurate. We're going to fix all of that today. Drop a comment right now. When you see a blood pressure number higher than expected, does your first instinct say worry or wait and see? I want to know where you're starting from. First, what do those two numbers actually measure? Most people treat them as the same kind of reading. They're not. They're measuring two completely different moments in time. The top number, systolic, is the pressure in your arteries at the exact moment your heart contracts and pushes blood forward. The peak, the high point of every single heartbeat. Here's something important for seniors. As we age, arteries naturally lose some flexibility. When a stiffer vessel gets that wave of pressure through it, the peak goes higher. This is why the systolic number commonly climbs with age, and that's not always disease. That's sometimes just biology. The bottom number, diastolic, is the pressure remaining in your arteries when your heart is at rest between beats. Not a spike, sustained background tension, and sustained pressure when it's too high causes a different type of damage than episodic peaks do. Both numbers matter, but they behave differently and they don't get treated the same way. Once you understand that, a lot of the confusion dissolves. So, what numbers are actually too high? Here's something that surprises most seniors. The thresholds change with age, and what's concerning in a 45-year-old is often completely reasonable in a 70-year-old who feels well and is active. Systolic, the top number. Below 120, optimal. 120 to 129, very acceptable. 130 to 139. I watch this, but for a senior over 60 who feels well, this range is often reasonable and not an automatic trigger for medication. 140 to 149. I take this seriously, but context matters enormously before I reach for the prescription pad. 150 and above, consistently, at rest. That's where I draw the line. Diastolic, the bottom number. Below 80, ideal. 80 to 85, extremely common, typically fine. 85 to 89, I want to monitor over time. 90 and above, consistently at rest. That deserves real attention. Simple rule for most seniors. A resting blood pressure consistently above 150 systolic or above 90 diastolic is what I consider genuinely too high. For seniors in their 60s who are otherwise well, I start getting concerned a little earlier. I don't want to see systolic consistently above 140 or diastolic above 85 sustained over time. Now, I just used a very specific phrase and I need you to hear it. Consistently at rest. Those three words change everything. Blood pressure is not a fixed number. It's not like your height, something you measure once and it stays the same. It's a living, constantly moving measurement that shifts dramatically throughout a single day. I mean dramatically. Walking across the room raises it. Stress raises it. Cold raises it. Caffeine raises it. Even talking during your measurement raises it. Rest lowers it. Sleep lowers it. Calm breathing lowers it. Here's a real example. A patient came in last week genuinely worried. Her reading at the pharmacy had come back 148 systolic. She'd been anxious about it all weekend. When she sat quietly in my office for 5 minutes and we took it properly, it was 126. Same person, same day. Two completely different readings, because the conditions were completely different. A reading of 148 taken when you're rushed, anxious, or caffeinated is not the same thing as a sustained resting blood pressure of 148, and the difference matters enormously for whether treatment is appropriate. This is exactly why I press pause before reaching for the prescription pad, particularly with older patients. If elevated readings only happen under stress, if home readings are normal, if the pressure comes down with rest, if the person feels well, adding another medication might actually cause more harm than good. Overtreating blood pressure in seniors causes falls, dizziness, fainting, kidney stress. Those are real risks that deserve as much respect as the elevated number itself. Which brings me to the measuring mistake most people are making, and this is worth paying close attention to. Here is the correct protocol. Sit quietly for 5 full minutes before taking any measurement, not scrolling your phone, not watching something stressful, just sitting. Feet flat on the floor, back supported, arm resting at heart level, bladder empty, not talking. After 5 full minutes, 2 readings, 1 minute apart. Record the lower of the 2. Do this twice daily. Morning, about 20 minutes after waking, before coffee or activity. Evening, as one of the last things you do before bed. Alternate arms day to day. Do this for a full week and collect 14 readings. Average all 14. That average is your true baseline. Here's what surprises most people when they do this properly for the first time. Their numbers are often meaningfully different from what they expected, sometimes lower, sometimes higher, because the single rushed reading they'd been going on wasn't representative of anything. If that 14-day average is consistently above 150/90, that warrants action. If you're in your 60s and the average is consistently above 140/85, that's worth a serious conversation with your doctor. But it starts with accurate data, and most people don't have it yet. For home monitoring, use a validated upper arm cuff, not a wrist cuff, not a finger device. I've linked the one I recommend to my senior patients in the description. Now let me tell you about the situations that lower my threshold for concern, even when numbers aren't dramatically elevated. Delayed recovery after activity. After you stop exercising, pressure should gradually come back down. If it stays elevated well after you've rested, that's a sign the cardiovascular system is under more stress than resting numbers alone suggest. Kidney disease. High blood pressure damages kidneys, and damaged kidneys drive pressure higher. When kidney disease is present, I take blood pressure control seriously at lower thresholds. Prior stroke or heart disease. If someone has already had a cardiac event, the margin for error shrinks. The organs involved have already been under stress. And symptoms. This one I cannot overstate. If your blood pressure is in the 140s/80s, but you're experiencing chest discomfort, new shortness of breath, visual disturbances, or you just feel persistently off in a way you can't explain, do not wait. Get evaluated. Your symptoms sometimes tell a more urgent story than the number does. I want to pause here. If you're over 60 and want clear, honest health information that most appointments don't have time to explain, hit subscribe right now and turn on notifications. That's exactly what this channel is for. And share this today with a senior you care about who's been confused by conflicting blood pressure advice. Now let's bring everything together. Here's what to take with you from today. Blood pressure fluctuates throughout every single day, completely normal. A spike in the moment does not mean hypertension. What matters is the pattern, taken under consistent, controlled conditions. Measure at rest, using proper technique twice daily for a full week. Average the results. That's your real number. If that average is consistently above 150/90 as an older adult, that warrants attention. But attention doesn't automatically mean another medication. It means an honest conversation about the full picture, symptoms, lifestyle, risk factors, and what the readings actually look like under controlled conditions. Here's the most important mindset shift I can offer. Understanding your blood pressure should give you control and clarity, not constant anxiety. When you know what to look for, when to act, and when to breathe, blood pressure stops being a mysterious, scary number and becomes a useful piece of information that helps you take care of yourself. For decades, medicine sent conflicting messages about blood pressure thresholds for older adults. Aggressively chasing the lowest possible numbers in every senior, regardless of history or symptoms, can cause falls, fainting, fractures, and a significant reduction in quality of life. The goal is not the lowest possible number. The goal is blood pressure in a range that protects your heart, your brain, and your kidneys, without creating new problems in the process. And finding that range requires knowing the person, not just the number on a printout. I've put together a free blood pressure numbers guide, a one-page reference covering the exact thresholds by age, the home monitoring protocol, the symptom patterns that need prompt attention, and the questions to bring to your next appointment. Many seniors print it and keep it with their medications. It changes the conversation with their doctor. The link is in the description, and it was originally created for my clinic patients. Drop a comment below. Did today's video change how you're thinking about your numbers? What was the biggest thing you didn't know before? I read everyone. Subscribe if you haven't. Clear, honest health information for seniors every week. And share this with someone who's been confused by conflicting advice about their blood pressure. This is the conversation their appointments haven't had time for. Next video, how to lower your blood pressure naturally. The specific lifestyle changes with the strongest clinical evidence and how to start seeing results in as little as 10 minutes a day. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making changes to your health management plan.